Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about marijuana and mental health. So let's learn and talk about these subjects with our guests. First, let's introduce Dr. Alishea Rowley, who has been a mental health clinician for nearly 15 years and specializes in depression and anxiety. Dr. Rowley, welcome to the program. Tell us a little bit about yourself.
Well, hello, Heidi. Thank you so much for having me. I am Dr. Alishea Rowley, Associate Professor in the Department of Educational Leadership and Counseling. I am so pleased to be here because I am committed to working to minority communities and normalizing conversations around mental health.
Great, thank you. And we also have Dr. Ischaji Robertson, a licensed psychologist with a private practice in South Florida. He's been doing this for more than 20 years. Dr. Robertson, welcome to the program and tell us a little bit about yourself.
Thank you, Heidi. My name is Dr. Ischaji Robertson. I have lived here in South Florida for about 20 years. My specialties are working with adolescents, children, adults, and I do psychological evaluations and therapy. And I also enjoy being a part of the community and bringing cultural competence and spotlights on Black males and bringing psychology to the community at large.
Wonderful. Well, thank you both for being our guests on this program. To everyone joining us live, please share, post, and tag a friend on Facebook to have them join us right now. We also want you to send us your questions about cannabis and mental health in the comment box, and we'll do our best to share them with our guests, or the Mary team will answer them for you on the Facebook page. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comment box. When you complete the survey, your name will be entered into a drawing for tickets to an iHeart Music event, courtesy of our partners at iHeartMedia. So let's get started. Dr. Rowley, I'm going to start with you with a question. Can you tell us what are some of the most common types of mental health disorders?
Well, thank you for that question, Heidi. Well, I can tell you that there's nothing common about mental health disorders because they are per each case, each person. With the individuals that I work with, especially in this season, we have lived through, all of us, I would like to say, are survivors living through an unprecedented time, a pandemic, and many of the issues in the clients that I am seeing are experiencing anxiety and depression because of being separated from family and friends and having what's been termed as COVID fatigue. It's been very difficult for many parents and children and families to adjust to a new norm with, online teaching and working remotely. I can say I have become an expert in that field, a fast learner of being able to have to have the challenge of balancing a relationship with dual professions. Both of us are professors and have children, and I'm seeing that a lot. A lot of individuals who are working from home with children are just really experiencing a high level of anxiety with the balance, and again, that depression and sadness with being separated from family and friends and normal routine.
Yeah, Dr. Robinson, what are you seeing? Oh, you're on mute, Dr. Robertson.
I am seeing some of the same things that Dr. Rowley is seeing. Um, a lot of anxiety, people coping with being at home for extended periods of time, and different relatives. Of course, a lot of us have extended families, and so when you cut off seeing the extended families, that's really cutting off a part of us, and a very difficult thing for us to cope with. One thing I did want to say, the way that I look at mental health that isn't in the books is, can we cope with our experiences? Are we experiencing things a little bit differently? Are we experiencing life as meaningful as before? And then the second thing is our capacity to cope with our emotions becoming too much? Are we reaching our ceiling? Is it overflowing? So instead of sometimes looking at the DSM-5, that's another way that I kind of conceptualize it. Is life meaningful to us? And also, have we reached our limit? Is our capacity overflowing? So those are some of the things that I see.
Yeah, and that's a good point, that kind of leads into my next question. What are some of the warning signs for someone? I mean, we're all going through the pandemic together. We're all going into the holidays together in the same kind of, crisis scenario with the pandemic. So what are some of the warning signs that you might be having a mental health issue?
So the first three things that I would look at are sleep, energy, and appetite. If you find that your sleep is changing in a big way, you have a lot of trouble getting to sleep, or you have a lot of trouble sleeping through the night, or your appetite has gone up, gone down, and your energy level. Those three things I kind of monitor. Other than that, you know who you are and how you are, and how you are operating or functioning at your highest level. And when some of those things are a little different, you forget things a little bit more, or you're a little more irritable. You're snapping at some of your loved ones in a different way. Those kinds of things. Those are some of the warning signs early.
Yeah, if I could chime in there, I would echo what Dr. Robertson is saying, because with this unprecedented time, we really we are bound by ethical practice with evidence-based counseling skills, and we do. I know I work closely or abide closely by criteria that really help to give us an idea of what the client may be coping with, or a diagnosis that may be appropriate. But in these times, we really do have to chime into, again, balancing what is happening in the world, our new norm, knowing our bodies with some of the symptoms that may be warning signs. So I echo everything Dr. Robertson said, but I also would say that temperament is a huge piece, because that, with what we're experiencing, there's a normal expected amount, of change and balance in our emotions. But it's really important to find ways of coping and tuning into ourselves, so we know just how far from the norm, we may be, especially with those eating habits. I find a lot with my clients, they're either coping with eating, or some people, when they feel stressed, are eating a lot less, or sleeping a lot more. So those are definitely some warning signs.
Yeah. So how should people cope when they're experiencing these, or they're starting to recognize, yeah, I have 2 boxes of cookies on my nightstand. I'm guilty. I do. I have a box of ginger snaps and a box of another cookie on the side of my nightstand.
In fairness, Heidi, it is a Girl Scout cookie time.
But, for those who are experiencing some levels of stressors in their life, what are some of the coping mechanisms that we could do to self-help?
Well, I just saw something pop up that someone said that they have difficulty with feeling anxiety going to the grocery store. I understand that.
Yeah.
So definitely some things like picking a grocery store that promotes wearing masks, or going at times that are the most comfortable for you. Dealing with people that are familiar and that you're comfortable around. And also remember that this is something that's not going to be forever, that is time limited. And taking your deep breaths, practicing meditation, all those things kind of help keep the stress level down. But and just realizing this is not going to be forever.
Yeah. And Dr. Rowley, we spoke before, and you gave some really good some good tips. I remember one called "Stinking Thinking."
Absolutely. Yes, Heidi. I want to say, along with what Dr. Robertson said, we have to challenge that stinking thinking, because oftentimes our anxiety, it comes from a thought. It's like a seed that's planted, and throughout the day, with the news being inundated with all this negative, coverage of COVID-19, you water that seed throughout the day, and if you don't combat those negative thoughts with intentionality, such as meditation or journaling, talking about those thoughts, because that's what happens. We just kind of operate in our silos. We use the same dysfunction that we may have learned generationally about the messages around stress, how to cope with stress. What do you do? Is it okay to talk to anyone? And what we do is we just internalize those things, and anxiety just it continues to build. And sometimes that, one of the things I'm worried about seeing when the pandemic begins to lift a little more is a real severe social anxiety with folks reintegrating themselves into the world. So I think that too, an internal resolve is really important with this thing. I think that you have to decide what you can do to protect yourself, and enough eventually has to be enough. So when you go to the grocery store, if you decide that I'm going to do the best I can, this is something that I have to do. I'm going to do the best I can by protecting myself, social distancing, wearing my masks, and then, going out there knowing that you've done your best, has to be good enough at some point. But also, some other options. If the anxiety is too much to lean into, I don't suggest avoiding it altogether, because again, that social anxiety piece is really important to consider. But grocery delivery is an option. Again, just as a minimal coping skill, I do not suggest that we begin to, get too comfortable with withdrawing from the world. But there are other options for coping with a severe anxiety, with the pandemic right now.
Yeah, we keep hearing a lot about isolation.
Yeah. 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 And the thing is that we have to be very careful about that. We have to use modalities that are available to us. I remember on Thanksgiving, Zoom was allowing unlimited Zooming for that particular day. And I'm assuming that they probably will do the same for Christmas. But it's important to stay connected. I like to call it a solar system, where you think about who your natural supports are. So it's important to reach out for professional help, but it's also important to know who's within your solar system. So think about you as the sun, and the planets are those around you who you can call on to phone a friend when you need some natural support. So I think that's also important.
Yeah, and I know Dr. Robertson, you said faith-based was another area, right?
Mhm.
Regarding,
Faith.
yeah, you
Yeah.
talked about that in our previous conversations.
Yeah.
Yes. Spirituality. A lot of people connect with their faith. That's very, very important. Whatever faith they may practice. Some people consider it more of a spiritual connection. I saw a question about how to connect with our male clients a little bit better. I
Yeah.
think I would answer that kind of generally. One of the most important things that a therapist does with their patients or with their clients, with their consumers, whatever word you use, is to connect, is to be
Yes.
empathetic. The relationship, the type of therapy that I learned about is emphasizes the relationship. I
Mhm.
know cognitive behavioral is very is evidence based behavioral. We have solution focused therapies. There's a lot of important therapies out there, but underlying all of it
Mhm.
is the emphasis on the relationship, making sure that our clients, our males, our females, do not think that they were judging them in any particular way, that they're not walking into those microaggressions they may see on the street or may see in different places. That also the way you decorate your office, what are all the little symbols and signals, and what are the things that you're saying to open up to your clients and make them feel happy and make them feel um, welcomed.
Mm.
Yeah, absolutely.
Dr. Rowley, did you want to touch on that before we dive into the next subject?
Oh, that's an excellent question, especially when you talk about males of color in our current society and climate. Building rapport is really, really important, and you build rapport. Depends on who you're speaking to. I'm not sure if the person that asked the question was a therapist, but therapists and people alike really have to work on doing internal work so that they feel comfortable enough with with normalizing conversations that may be uncomfortable. So various treatment options for some of the symptoms that they're experiencing. It's really important that they know that they can go to a therapist and they can speak to someone who does not appear intimidated by them or is not intimidated by the conversation, because there is so much going on in people's lives. They've experienced so much by having to face many of the issues that they may not have faced when life was just going and going. Now it's about facing ourselves, and I'm finding a lot of difficulty with that. So some of those conversations that need to be had are uncomfortable, and they really do need a safe space for discussing those things. And it's really important too, just that unconditional positive regard, that genuineness, that empathy, because it's not possible, especially if you have not experienced, things that, a male, for example, or a Black male in our society may be experiencing. You can empathize if you can't sympathize. So at least, try to understand what it must be like to walk in the client's shoes in order to have a deeper connection.
Yeah, let's talk a little bit about the stigma about mental health in minority communities, especially among Black and Hispanic populations.
Yes.
What causes this, and what can be done to help change that stigma or help reduce the stigma?
Mm,
Well, the stigma with therapy in African American and Latino populations, it's kind of twofold. One, when people come into some places, mental health centers, different places, there was a study some time ago that showed that African Americans kind of get multiple diagnoses and get too many or get over pathologized. So there's something going there on one hand, and then on the other hand, it's the whole idea of disorder, the idea that by coming to talk to someone that there's something wrong with you, and it's really the opposite. There's certain therapies and there's certain therapists that want to work with people that are already doing well and get them to the next level. So
yeah.
it is really something that takes a lot of character and strength. So I think that's something in the population that people need to kind of understand, that there's really not a problem. So that's why we try to kind of put down or not emphasize words like disorder, maybe even mental health. If people want to call me a counselor and not a psychologist, that's fine. If they want
Yeah.
whatever they want to call me,
Yeah.
I just want them. I'm just a person helping them.
Hmm.
Um, and I think religiously, they may think that religion or their spirituality or their church is all they need, which is true, which is something that is very helpful for them. But also, as clinicians, we have some expertise that may be able to support what people are getting from their church, and not go against it.
Yeah.
That some people think it's either a psychologist or a pastor. It could be both.
Hmm.
And we're definitely in. There's this idea that we're all atheists. That no, I take whatever the client brings in and is their strength and uses that. Positive psychology is very important in emphasizing whatever strengths that the individual has and trying to build upon that.
Hmm.
So I think it's a couple of things that are going on in our society which kind of contribute to that.
Hmm.
Yeah.
Dr. Rowley.
Well, I think we cannot approach this question without discussing the historical implications of stereotypes that are associated with oppression. These two communities in particular have a long-standing history of oppression, and then our current society really encourages that narrative with the increasing of killing of Black man, of unarmed Black man, of a story that just came out in the news the other day with the Black social worker who was targeted by accident from the police, and they burst into her home. I mean, these things are really, they really do have an impact on the trust, the level of trust that African American and the Latino population that they may have with reaching out for help. So it's a loaded question to answer for, how we assist a person with, making them more knowledgeable about the experiences of an African American and a Latino person. I think that is on a case by case basis, and to the level of, of interest in connecting with that community. But I echo what Dr. Robertson said about understanding about where the client is coming from and what trust issues may occur. I saw a comment that talked about finding a therapist, and how it feels like that good fit feels like medicine. And as the clinician, we really do need to understand the power of that connection, the power of gaining the trust and maintaining that trust and rapport with clients, and understanding how difficult and how courageous of a move that must have been in the first place for someone to seek the help. And so we really do need to protect that relationship in treatment options as we think about treatment options for communities of color.
Yeah, well, you brought up a really good point, and Dr. Robertson kind of touched on it earlier. The term disorder, or that something is wrong. So for those who are watching this, my question to you is, how do you ask for help? What do you all recommend for someone who is considering, like, I think I need help. I don't know how to ask without feeling a certain kind of way. Do you all have any recommendations?
Well, I'll start in with that. As far as asking for help, I think it's important for people to be involved in their community, to attend events like this, and then you get to know about people who are out there, like Dr. Rowley and myself and other um, resources that are there. You also have your friends. You have not 911, but 211 and different
Yeah.
community resources that and we can name them later. I don't know if you want us to
Yeah,
do that
please.
at
You
this.
could do it through the course
Okay.
of the conversation. Absolutely.
Okay. So there's the Association of Black Psychologists, which I'm a member of and a past president of the South Florida chapter. They have about 3 chapters throughout Florida. You can go to the Association of Black Psychologists. They have therapists that are listed there. You can also call some of the chapter people and talk to them. So, and then there's also the Association of Latinx psychologists. If you can get resources that way. There's also something through the association, the American Psychological Association, called Sine Paemi, which is a cohort of different ethnic psychological associations, and you can get whether it be Asian or Native American.
Oh, that's good.
So I think that it's important to know about those resources and friends. Your friends, they can make recommendations, and to speak to people that you trust, and to do your research. And once you call someone, kind of find out if you want to work in a short-term way or a long-term way. I'm trained in both short and long-term therapy, but my preference is long-term therapy.
Yeah.
So if you want to work with somebody and you want to get your symptoms relieved in 10 or 20 sessions, you would probably work in someone that's really trained in a short-term type therapy. So your conversation with the therapist, and also about culture, I think is very important. Those are some of the places that I would start.
Good. And before we go to Dr. Rowley to respond as well, I want to let all of our viewers know that we will post links to those organizations in the comments in the Facebook chat after the program. Dr. Rowley.
Yes, this is one of the most important questions, I would say, because I always forget this, and I can't, it's a cliffhanger. Once we start talking about mental health, we absolutely have to link the listeners to a way of finding a therapist. A therapist is like a relationship, and you can't just, it's not a one size fits all. And I tell people that because it's so imperative. It's such a big step to want to reach out and to make that step to develop a relationship with a therapist. But you have to know that not every therapist, not the first time may not be the best fit, and that's okay. I would start at Psychology Today. Psychology Today is a great resource because it does have the bios of the therapist or the agency, and you can see pictures, and you can, read about their experience, about their expertise. That's a great way to start and to get some information about who might be the best fit for you. Another thing I have to say, so many people don't know about EAP, which is Employee Assistance Program benefits. So if you work, for example, for in most 9 to 5 or agency type settings, human resources is where you would go to find out whether you have EAP benefits. So EAP benefits, at the least I've seen, they provide anywhere from 3 to sometimes 8 sessions of counseling to get you started based on whatever you're reporting. Now, one secret about that, and many people don't know, is that those sessions are per occurrence, whatever occurrence you're reporting. Okay. So I'm not trying to tell you a way to get around and get more sessions, but it is true that if you, for example, go and you report, feeling some symptoms of anxiety, and you use your 8 sessions and you still are feeling, or say you take a break and you are, still feeling some symptoms of, something else that may not be anxiety, but related to depression, then you can request another 8 sessions. And that is a great way of getting started. The last place I would say is to check with your insurance company. For those who are looking to use insurance, go to your insurance company, the behavioral health area at your insurance company. You can go online and they will give you a list of providers that are in network. And according to whatever your benefits are, you pay a copay, and then your network would pay the remaining balance for therapy.
That's really good information, Dr. Rowley. Thank you for sharing that with our listeners. We had nearly 100 people register to attend this program before it started today. And several of them actually sent in some questions. And I want to ask you all one of the questions that we received from one of our registrants. She said, I have really been working hard. I'm a single parent with 3 children who are learning remotely as I work full time. I'm approaching the break and have no idea how to begin to wind down. Any tips? And Dr. Robertson, I'm going to start with you because I do know that you work within the school system. So let's talk about that. Let's start with you.
I think the first thing is really important to have boundaries, to understand when you're away from work, you're away from work, and to start doing some of the things that you enjoy. If you can, and make sure the phone is put down, that you're not answering phone calls from work or trying to do things, if it's possible, that have to deal with work. So there's a clear work life balance and a separation. And then after that, it's important to do some of the things that you enjoy. Make sure you're, like, for example, one of my favorite activities is bicycle riding. So when I do that, I'm really enjoying myself. So make sure you do that. That you're also not allowing the time of the holidays and the financial expenses and all of that to overwhelm you, that you're trying to find meaning in the holidays in whatever way you subscribe meaning to, whether it be being with people and just enjoying, or there's something in positive psychology called a gratitude diary. Um, Things that you're grateful for. So I think that those are some of the most important things, and just remembering to give yourself breaks.
That's good. Dr. Rowley.
Mm-hmm.
I couldn't help but to laugh at this question a little bit, Heidi. I said, my goodness, if it weren't for the 3 children, I thought that may have been me asking that question. It's so funny. I was working with my son the other day on adjectives and adverbs, and I said, so take mommy, for example, and tell me some descriptive words about mommy. He said, "Mommy takes care of us." And then I said, "Okay, and what else?" And he said, "Mommy works a lot." And I laughed a little bit because I thought, gosh, is that a compliment or what?
Right.
You know, the thing is that when you're a hardworking parent, it's really you're balancing quite a few things and quite a few what it's called in research intersectional identities, and that's what it sounds like this particular person may be balancing. A person who works, so you are an employee, you are a mom, you are a friend, you are a sister, you could be many things, and so that is tiring and it can be exhausting. And I love what Dr. Robertson said about boundary setting, and I like to give like a visual of being before you step outside your house. Like, just say, for example, there's a crowd of people who want something from you outside of your door, and they want a cup of milk, right? But you need milk too. So you decide how much you can give before you step outside the door with your glass of milk. So you decide, well, this is all I have to give for today. And if it's work, you give it to your workplace. And then when you're done, when you've given all that you can give, then it's important to work really hard to step back from that. I would also say it's nothing wrong with doing nothing, because I can tell you that when you feel like you're working a lot, when you're at home, the first thing you want to do is what? Tackle a million projects and Christmas shopping and all these other things. But connection is what your children want. They want you. And so I think that instead of thinking about all these ways that we can overcompensate for our time, I would give the most important people just what they want, and that is your time. Just like we went and gave it to our employers and we have given it to our friends, it's important for us to take some time and give it to the ones that we love. So
I have to tell you, what you just said just really resonated with me in so many ways. And I do agree. I think my family just wants me.
yes.
They just want me. So,
And Heidi, it's okay. You need to sit on the couch with your, veg out with your sweatpants on and just, and get takeout. It's important for us, again, and not to, it's so easy, especially with social media, and we see all these perfectly made families who are, out there, and God bless them if they're doing it and it looks just like that.
right.
But most of the time, and again, this is where the discussion about mental health comes in. The how healthy we are mentally is just really normalizing just the chaos. It's chaotic sometimes, and it was chaotic for a long time before the break. And so that's okay. It's okay not to tackle those projects and for things not to be perfect. But that connection and that time with your children, you can never get back. So that's what I would suggest.
That was really good. Thank you.
I agree 100%. The time with the family is so important. Our children, our family members need us.
Mm-hmm.
And just like you said, being there for students or for the children in the schools, for our clients, our children, our family members need us the same way.
Mm-hmm.
Just sitting there listening. I know sometimes people, my daughter said to me, "I want you to be my psychologist."
Mm-hmm.
So,
wow.
Wow.
That's good.
Wow.
That's good. That's good. Well, I want to now take like the last 30 minutes of the program and really kind of shift to a conversation about cannabis and find out, what are you all seeing and hearing about medical marijuana as a potential treatment for mental health? Because in Florida, medical marijuana is legal, and some of the qualifying conditions include mental health. So I'll start with you, Dr. Rowley. Can you share with us what you're seeing and hearing about medical marijuana as a potential treatment for mental health?
Yeah, it's interesting, Heidi, because I'm going to tell you what I'm seeing. I'm still seeing the lack of a normalized conversation about marijuana and cannabis, period. People are still afraid to come out and talk about it at all.
It's taboo still.
It's very much so, because especially, again, when you talk about some of the issues with historical oppression and African American populations, in the criminal justice system, where people were, going to jail for long periods of time for even, using cannabis or having being caught with possession of it at all.
Right.
So it's still very much taboo to have that conversation. So it's interesting because I'm not having many people to come out and, I think it's a liberation. It's those, those clients who may feel, or have more information about it. They may talk about it. And I think the most important thing to say, for me to say, is that, I am not a prescriber. I am a licensed mental health counselor. So I don't prescribe medication, nor can I prescribe medical cannabis use.
Okay.
So I think that the important thing to do is to collaborate with other professionals. And that's what we do. We collaborate with psychiatrists who can prescribe, or your primary care doctor, for the best treatment option for the client.
Okay. Dr. Robertson, did you want to comment on that?
Sure, I agree. Dr. Rowley, you're so good at this. It's just like, of course, no. Ditto. One of my main interests was I remember being on a panel before medical marijuana, the legalization passed,
Mhm.
is the impact on the community and what's going on in the community. So that's my main interest. And like Dr. Rowley, I as a mental health professional, and especially here in the state of Florida, the psychologists do not prescribe medications,
Mhm.
and I am not an expert on the literature on it. So I would definitely try to get the resources that you're going to speak about later to find out more information. One thing I just wanted to say, I believe that the mind, uh, unless things start to get where there's a life or death situation, or people are not functioning, not being able to go to work, not being able to talk to loved ones, that is when I really think that a medication, or I want to not just stop therapy, but want to either do it in conjunction with the psychiatrist. I believe when you look at the human body, what it's capable of and what our mind is capable of, there's a lot we can do just with talk therapy, just with so I don't want people to just kind of forget about that. If they have an interest in medication, they have an interest in using medical marijuana, by all means, definitely be educated on it and look at somebody who's competent, that has experience with those types of medication, or with medical marijuana.
Great. And then just for everyone who's watching, we want to encourage you to go to the Florida Department of Health's Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana ID card in the state of Florida. OMMU provides information and resources that would point you to the right direction on how to obtain medical marijuana legally, as well as the qualifying conditions that do include some mental health issues. And for information in general, we also want you to go to the Florida A&M University MERE website. That's MMERE, which stands for the Medical Marijuana Research Education Initiative, that's bringing you this program today. Be sure to check out their website for additional information. We really want you to do that. And we also encourage you to please tell us how we're doing and complete the post-event survey, because this was a wonderful, wonderful conversation. You guys provided such a depth of information. And I want to thank you all for being our guests. Before we close, is there anything else that you'd like to add for our listeners? I mean, we have dozens of comments in the Facebook chat right now. You all have really been sharing some wonderful information. So, Dr. Robertson, anything that you'd like to close with that you didn't share in our previous questioning?
Sure. The first thing would be give the relationship with the therapist some time. Some therapists, some mental health professionals recommend 5 sessions. If you can do that, that's good. Give it a 5 session kind of warm up time. And it's also important to see if you can connect with that individual. And just remember, the relationship with the therapist is probably the most important thing. I always encourage clients that I have to tell me how they feel. If there's something I said, or something that's come up in the course of the session that they don't like, or they have a feeling about, I'm the person to really express that to. So the relationship is pretty much therapy to in the way that I've learned it. And the second thing is, especially with African Americans and with other ethnic minority groups, we can show signs of stress through physiological symptoms, through pain, through gastrointestinal issues, through all other kinds of things. So physical symptoms, when you there's a study that looked at a large percentage of people that went to the doctor, some of it had some type of psychological explanation. Not to say that there's not a medical
Yeah.
issue there,
Yeah.
but it's important for our own physical benefits to sometimes deal with the therapist. And I would also say use a therapist as a prophylactic, something that is going to keep you from developing major symptoms, that you can work on the underlying issues. Why am I getting stressed? Why
Yeah.
don't I like myself?
Yeah.
Why don't I feel comfortable here in this earth? Or, whatever it is, you look at those issues, and then that helps to prevent the symptoms from coming, that you don't even have to go get on a medication in the first place. So that's what I would like to add. And
Mhm.
it's been a pleasure.
Okay, well, guess what? My technical producer just sent me a note and said, people have questions. So, Dr. Rowley, before we'll let you do closing questions, but we do have some folks who have some questions. And right now we see a question from Holly. How do we help children deal with their feelings so they find strength in sharing what's on their mind?
Mm.
Who wants to take that question?
That's such a great question. And I'll say, I started off in my career as a school counselor, and I'm actually I still have my active license in guidance in school counseling right now, along with my clinical license. And I work in conjunction with mental health and school systems as well. It's really important for us to give our children a voice. We often forget that we were in their position, maybe me, I know it was just about 10 years ago, but you know, but it's difficult. It's funny. When I'm working with children, one of the things that I explain is that you can't work with children sans the family, without the family.
Right.
It's important to understand that it is an inclusive effort. So it's important to, I think one of the things I do when I'm working with children is reduce the hierarchy. They get discipline everywhere they go. The adults are the authority figures, and it's very difficult for them to find their voice. And because of that, we miss opportunities to connect with children. So I would say reduce that hierarchy. Even as a parent, if you're a parent, I'm not sure where the person is asking this question, but you have to create silos of space to talk about certain things. There's a time to be a disciplinarian, even if you're a teacher. There's a time for that, but there's also a time to connect when you see a child needs a space to talk openly without judgment. And that is, I think, that would be my biggest piece of advice to that person, is to strengthen them by giving them the power to have a voice.
Dr. Robertson, would you like to comment on that?
Very well said. I would probably say I'm a clinical psychologist that also works with children in a K through 5 school as well as a K through 8 school. I would say most importantly, it's important for them to be able to express their feelings. And sometimes they don't do that with words. They do that through art. They do that through pointing at the words, feeling words that we have on our walls.
Yeah.
And so that would probably be the first part. So depending on the age, they're going to be kind of pre-verbal and not so talkative. And, I feel this way. I'm very happy today. You're not going to expect that out of everyone. So I think to encourage them as they can identify their feelings, and we can also say, oh, Sally, it looks like you're feeling a little sad. Is that the word? No, that's not the word. And helping them to find their own voice. And with some of the children, I have a 10-year-old, or actually she's 11-year-old, who doesn't like to express herself. So we work on assertive communication, saying, using I statements. So it all depends on the age. But the main thing is to let them know that they have a safe space, just like Dr. Rowley said, that in the relationship between you and the child, that is something that they can always remember, that they've have their safe space and they can express it with you. So then later they're going to express it with other people. I did it with Dr. Rowley. I did it with Heidi. I did it with Dr. Robertson with Ishar, and I can now transfer that to other people. So I would probably say that, and just remember that there's nothing wrong with art therapy, journaling, and then later they find their own words.
So now we have a question from Tamika Bugs, who says, how do we talk to our children if a parent has to use medical marijuana? That is a great question.
That really is a great question. If you don't mind, I'll chime in on that one, Heidi. But again, I cannot express how important it is for parents to really lean into the experience that we've been having especially during COVID-19. It's important to have open and honest conversations with your children, and also to understand that the use of medical cannabis does not always come in the form of smoking. So that's the biggest fear that I always hear, especially from parents, is the judgment about smoking. Medical cannabis can come in all different forms, that you could do discreetly, but and not necessarily, it may not cause for a conversation about what you see mommy or daddy doing. But it's important, I think, just to open up the conversation about mental health, and like Dr. Robertson was just talking about, to do it in an age appropriate fashion. And it really does depend on, the language ability, the level of conceptualization. And I think that you have to take all those things into account. And I think that, just round robin conversations, and I hope that people do this more, as, the holidays are coming up, and, we are spending, many people are spending more into or having more intimate holidays this year.
Yeah.
And sitting around and having family discussions about how we feel is a start.
Yeah. Yeah. Dr. Robertson, did you want to comment on that?
I think she said it all. I agree.
Okay.
I agree. I think it's nice to be open
Yeah.
when they ask questions about what's going on with us, like why do we, So I think that's important, and they give them the best answers. I think that's the most honest and age appropriate answers that we can. Answered very well.
Well, we have some comments from users saying that they want to hear us talk more about cannabis and mental health. And I know that for you all are not, you all do not, Dr. Rowley, use your legal language for your role when it comes to cannabis, so that we let people know that we really want to direct you to the Florida Department of Health's Office of Medical Marijuana Use to get more details, and also how to find a licensed physician that you can talk with about medical marijuana. But I want to give you all the opportunity to just share your position when it comes to medical marijuana, when it comes to your practice, for those who are joining and asking, can we talk more about it? I just want to make it clear what your role is. Dr. Rowley, and then Dr. Robertson.
Well, I want to ask first, Heidi, are there any specific questions or general questions about, whether medical cannabis is something to be used with mental health?
Yeah. A lot of it is, just your professional opinion on whether it should be used. And I do know that, we have laws in Florida, and there are qualifying conditions, and that people need to go to a licensed physician to determine if they qualify. So I don't want to put you all in a position that compromises your role as a mental health practitioner. So that's what I want to share with our listeners. But do you want to comment on that?
Yeah, sure. So I want to make clear, I'm not afraid to talk about medical cannabis. I can give you, I think this is my position, to have the open conversations. Medical cannabis is this is the same conversation I would have if we were talking to, having a discussion with a client about the decision to take a medication for a mental health disorder. I think that we have to be so careful, though, to operate in our roles. So, as clinical persons, as clinical therapists, what we do is collaborate. So, we have this book, this big book that Dr. Robertson he alluded to, but it's called the DSM. So it is a book of diagnosis that is kind of like a language that's spoken throughout the medical community, amongst psychologists, amongst licensed mental health counselors. And what we do is it helps us to kind of translate so that we understand as a whole, what a client may be experiencing. So, for example, as what Dr. Robertson said was spot on about those physiological symptoms. I see that so often where, unfortunately, because of the stigma around mental health, you have many clients who will go to their primary care doctor, which is a great place to start.
Right.
But we also need to normalize that conversation with our private practitioners to refer over to clinical mental health, not just solely medication, because whether it's cannabis, whether it's Xanax, whatever it is, it's not a magic pill. It's not a one size fits all. So it's important to do that in conjunction with working out your stuff. See, sometimes people do need some assistance, so I don't want to ever, I don't want to ever be on the side of advocating for or not for medication, because I think it's individual for whomever, whatever's best for you. But I will say that I can say definitively that it's not a magic pill. And you may find the need to continue to up dosage and have more or, more medication if that is the sole use of or the sole primary coping mechanism for whatever kind of mental health issue may be occurring. So I think I think people get confused when they talk to mental health professionals and they don't get like a straight answer about, hey, should I use cannabis to treat anxiety? There are pre-existing conditions that need to be considered. There are all kinds of things that we can't answer from our expertise. So I can say, as just my position as a therapist, I'm absolutely open to the discussion and to collaborating with other professionals that can assist the client in knowing which treatment option would be best for them.
Great. Well, thank you. Thank you. Dr. Robertson, did you want to comment on that? And you're on mute right now.
Sure. I want to echo what Dr. Rowley said. I agree with that. My experience has been with medical marijuana. I did a psychological evaluation probably a couple months ago, and the individual had been using, in the past, he used recreational marijuana, and then he said he had his marijuana card and was able to use medical marijuana. My just concern is that then the treating psychiatrists, I don't know if they knew the information, that they were the ones that they knew about the medical marijuana. So people have to be knowledgeable of what someone is treating. Like, for example, if you're seeing two different doctors, you have one medication, another medication, you want to put that all together to make sure that they're not counteracting. So I think it's most important is to be open and, and to discuss it with people, especially people that are experts. As a clinical psychologist, my go-to thing is talk therapy. Well, besides psychological evaluations, my go-to is talk therapy. So in my experience, not with medical marijuana, but with recreational cannabis, is I've seen some clients who have not been as motivated. To be in therapy, you have to be motivated. You have to talk about some things, depending on the type of therapy that you're doing, that are very traumatic, very stressful. How you experience this, or how you experience that. And if you're not raw and you're not motivated, and something else is kind of making you feel a little better in the background, I don't know that I'm getting the most out of the individual. What I've seen in the past is sort of a flat line. And again, I'm not speaking about medical marijuana, but in the past. So I usually like my clients for a recreational use is to be abstinent for a while, or I'll refer them to to AA or NA or an educational thing, just so that when they come to therapy, they're working at it raw. Again, this is not medical marijuana, so I
Right. And
need to know a lot more
recreational
about the
yeah.
right. But
And
yeah,
recreational is illegal in Florida. Just
right.
let
It's
people
it's
know that.
illegal.
It's
But
illegal.
yeah, but yeah, but anything, you just kind of know what you want to what you're working on. If you have something a medication, and you're also working on not being so stressed, you're working on doing your deep breathing or your ABCs or your meditation or whatever. You don't want to let go of that because there's something else. So that's something and that's why I agree with Dr. Rowley 100% that it has to be a collaboration, and we as mental health clinicians that are not medically trained can't really speak to that. We have to refer them to people.
Yeah, and it sounds like the entire process of getting support is a more collaborative effort, right? So your primary care physician, your doctor, your therapist, and
Mhm.
your family. It's everyone is working to help you get through. But we have about 5 more minutes left in the conversation, and Dr. Rowley, I want to give you the opportunity to give some closing thoughts.
Mhm.
We heard from Dr. Robertson before everyone said, hey, 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 I have questions, which is great. We thank you all so much for the
Yeah.
questions for all of our viewers today. But Dr. Rowley, let me have you close out and share some closing thoughts, please.
Yeah. Well, Heidi, thank you so much again for having me. And this is just this was an exciting conversation about mental health. I am so very passionate about having this discussion. And, listen, I just want everybody to know that I'm proud of you just for being here. If you're here right now listening, you made it through almost a year of a pandemic, and there have been so many ups and downs. And through it all, however you survived it, and I'm happy for you, and I'm happy for myself, for surviving it. So I think that if you have any takeaway, just remember that um, courageous conversations are needed to normalize the conversation about mental health. And if you need help, there's nothing to be ashamed of. There are people that are out there, like Dr. Robertson and like myself, that are ready and willing to assist you and to talk with you about some of the things that may have been debilitating. So I really just appreciate the fact that you were willing to log in today and to listen. And I wish everybody peace and wellness and a happy holiday season. And just know that it's no need to walk alone, no need to carry all those bags on your back. There are plenty of people that have been trained and are passionate about helping others, and are here to help you.
Wonderful. Thank you. Dr. Robertson, any last comments you want to make?
Well said. Thank you for being a part of this conversation. Continue to join other conversations like this. Maybe not as good, but and
Those
I
are
just
good
want to say,
conversations.
I just want to say this. I was very, very kind of anxious about being a part of this, but it's been very special to me meeting both of you and hearing the questions, and we're in good hands. If this is the future of mental health and where mental health is with therapy, Dr. Rowley, you're just excellent, and I think we covered it pretty comprehensively. I mean, not can't get to all the details in an hour, but excellent.
Right, right.
Thank
Yeah.
you, Heidi, for doing this.
Well,
Mhm.
we want to thank the Florida A&M University Medical Marijuana Education and Research Initiative for coordinating this conversation on cannabis. And Dr. Robertson and Dr. Rowley, thank you for being our guest on this. For everyone who's watching, please enter your information we want you, Dr. Rowley and Dr. Robertson, to please enter your information in the Facebook chat after the program is over. And then for everyone who is watching the forum right now, please don't forget to take our survey, because again, if you enter the survey and tell us what you think about this program today, you will be entered into a drawing for an iHeart Music event courtesy of our partners at iHeartMedia. And we also want to remind everyone to please visit the Mary website and the Florida Department of Health's Office of Medical Marijuana Use, OMMU, to learn more about recreational marijuana in Florida, the laws there, and then also how to obtain a legal medical marijuana ID card. Thanks everyone for watching. We really appreciate you being with us, and please share this program with your friends and drive them to watch and learn. Thanks so much, everybody.
Thank you.
Thank you.